Body of Anesthesia and our principal, a medical specialist of anesthesiology, who is also interested to be a legal luminary and to guide us in the dark path of our practice to the luminescent outcomes. Doctor is Dr. Alla Prasanthi, MD, Medical Director, Tulsi Multi-Speciality Hospital, Guntur. Now she is going to deliver a guest lecture, Medico Legal Awareness for Safe and Ethical Practice. We have to learn first safety of our practice on a background of ethics or otherwise, but we should be safe. And to this extent, I welcome you, Madam Dr. Prasanthi, today's for guest lecture, and she will be introduced by Dr. Neha Swata, Assistant Professor of Anesthesiology. Please do it.
Privileged to warmly welcome our respected Director General, Director, Principal, Medical Superintendent and Convener Academy, Dr. Ishwar Sir, faculty members and resident gathered for this meeting. I take this opportunity to introduce our esteemed guest, Dr. Alla Prasanthi ma'am. She has done her primary education in Ongole, completed her MBBS in 1993 from Guntur Medical College. She did her diploma in accident and emergency medicine at SRMC Chennai. She completed her diploma in anesthesiology in 2008 at Guntur Medical College. Her enthusiasm in academics went beyond medicine. She has also done a hospital and healthcare administration from Nagarjuna University. She has also achieved her LLB degree from AC College of Law in 2022 in Guntur. She is currently the Medical Director of Tulsi Multi-Speciality Hospital, Guntur. Ma'am has also held various roles in Indian Society of Anesthesiologists as an executive member from 2017 to 20, Vice President from 20 to 21, Vice President-elect from 21 to 22, and President from 22 to 23. She has also worked as a Vice President in IMA AP State Women Doctors Wing. Ma'am is also a APNA State Legal Executive and Executive Editor of ICRF newsletter. A small video clip will be played, which is done by Ma'am. This is the video clip of showing anesthesiologist to Darshavataram.
In the operation theatre, when life hangs in delicate balance, one silent guardian stands watch, the anesthesiologist. Like the Dashavatara, the 10 incarnations of Lord Vishnu, this healer takes many forms to protect life. When breath gasps and life seems lost, Matsya appears, rescuing the drifting breath from the depths. When the pulse begins to fall, Kurma, the steady tortoise, supports the fragile one, carrying the burden of life on his back. When chaos surrounds the theatre, Vamana takes control in 1, 2, 3 precise steps. bringing life safely back to shore. When crisis strikes suddenly, Narasimha, fierce and compassionate, masters dual roles, restoring harmony. When the body calls for fluid therapy, Parashuram strikes with precision, conquering the central venous kings with the luminous axis. When pain rises with 10 heads, Rama releases a single arrow, blocking them all at once. When the mind trembles in agony, Krishna spreads the magical ripples, calming the storm within. When the operating field grows tense, Balarama plows confidence into the hearts of the team. When the surgery is done, Kalki awakens the patient from the veil of anesthesia back into the world of consciousness. One purpose, protecting life, silently, vigilantly, every moment in the operation theatre. The anesthesiologist, the modern Dashavatar.
Thank you, ma'am, for sharing this beautiful video. I welcome you onto the stage to share a valuable message with us.
I thank the management of SIMS Medical College, the principal, Dr. Bhimeshwar sir, Dr. Ishwar garu, Dr. Suresh madam, everyone present here. I take this opportunity today to present about the medical legal awareness for doctors, why it is important and the safe way to practice. शरीरे जर्जरीभूते व्याधिग्रस्ते कळेबरे औषधं जाह्नवी तोयम. Vaidyo Narayano Hari. This was written by Sri Charaka in his Charaka Samhita. But no longer these days this is true. What this really means is, when the body suffers from fever, sickness and old age, may this medicine becomes as charged with curative power as the holy Ganga, and may the physician be the supreme Hari himself. Once upon a time, physician or doctor is considered equal to God. Gone are those days. We now have to face legal implications for all the acts we do towards the patient care. So, why medico-legal awareness matters? To protect patients' rights and safety. Then, if we have this awareness only, we can prevent avoidable litigations. To strengthen documentation and consent. This awareness improves doctor-patient communication. It helps in ethical and emergency decision making also, and safeguards professional reputation. Thus, it builds trust in healthcare. So, these days, medico-legal awareness is not a defensive medicine, it is a responsible medicine. So, just we will see 2 or 3 cases and then we will go to the actual subject. This is a case done in 2011 and the judgment was given in 2024. Surgery done for left nasal polyp. Patient later developed swelling of the left cheek and eye by evening, loss of vision by next day evening. So the doctor assured your vision will improve gradually. Later, patient went to an ophthalmologist. He investigated and it was diagnosed as left optic nerve injury and due to medial rectus and also left medial rectus nerve. So a consumer case was filed. Patient claimed 94,000 as costs of treatment because it was in 2011. They only claimed 94,000. And for costs of treatment, but as compensation, 10,20,000 for loss of his earnings and 1 lakh for his pain and suffering. So the district forum ordered 51,000 for medical expenses, 50,000 for compensation, 2,000 for litigation costs. The state forum judgment given in 2024, it observed, see, manipulation of case sheet entries. So someone has written earlier something and it was manipulated later. Everything will be evident in the case sheet. So the manipulation, the forum has observed. So they increased the compensation to 1 lakh and litigation expenses to 10,000 and 8% interest from 2011. This is another case of tonsillectomy. 13-year-old operated for tonsillitis, died after 2 hours. So they sought a compensation for 90 lakhs for the loss of life, mental agony and torture, and 25,000 as cost for litigation. The autopsy report revealed that child has died due to suffocation because of aspiration of the blood and blood clots which directly resulted from the site of operation, which was sufficient to cause death in ordinary course. So, see, the ENT surgeon and the hospital, they were ordered to pay 75,000 each, amounting to rupees 1.5 lakhs besides 10,000 as costs. So both have to pay, the surgeon and the hospital. Now, so why all this? In 1993, Supreme Court brought medical profession under the Consumer Protection Act. From then onwards, all these problems. What is this Consumer Protection Act? This Consumer Protection Act was legislated in 1986. It is a benevolent social legislation that lays down the rights of the consumers and also provides means for their protection and promotion. So now the patient has become a consumer. Okay, so we have come under the Consumer Protection Act. And now, for higher pecuniary limits, have been fixed for commissions. Now they call it as consumer forums. District forum, state forum, national forum, like that. So district commission has been empowered to entertain consumer complaints not exceeding up to 1 crore. Before previously it was 20 lakhs. And state commission up to 10 crores. National commission above 10 crores. So this can encourage people to seek higher compensations at a local level. He can go to district forum and claim for 1 crore. And these complaints can be filed online and in the jurisdiction of residence of the consumer. Previously, it was at the place of purchase or transaction or where that happened. Now, they can file at their workplace or at their residence or online also. And also, provision of hearing through video conference has been introduced. So, all this adds to the convenience of filing a complaint and also attending the case from the comfort of home or office. So, what does this translate into? Increased number of cases being filed against medical professionals. Just like that, they will put a case. So, let's see what is medical negligence. Negligence is a breach of duty of care resulting in injury or damage. It contains 4 essential components. These legal elements must be proven. One is a professional duty owed to the patient. When a patient is admitted with us, we owe a professional duty towards the patient. We must fulfill that duty. Then, is there a breach of such duty? If we don't do the duty properly, there will be a breach of such duty. Then, does the breach of duty cause an injury to the patient? That should be proved. Then, fourth, what was the injury and what are the resulting damages? So, all these 4 legal elements will be taken into consideration while dealing with the case. So, if you don't owe a professional duty towards a patient, a patient was admitted under one doctor and they have filed a case on another doctor or along with the doctor another doctor, but you are not involved in that case, then you don't owe a professional duty. Like that. Is there a breach? Have you not done whatever you are expected of as a professional? Then there will be a breach. If you have done it according to protocols, then you have done your duty. There is no breach. Okay? And even if you have done breach to your duty, does that cause any injury to that patient? That is also important. If a harm has occurred to the patient only, then it will come as medical negligence. Okay? So, what are the consequences of this medical negligence? Criminal liability, civil or monetary liability, disciplinary action. Let's see what is the criminal liability. Section 106 of BNS, Bharatiya Nyaya Samhita. This is like, they deal medical negligence cases like motor vehicle accident cases, like death by rash and negligent act of a medical practitioner while performing a medical procedure. So, if you performed a surgery on a patient by a rash act or a negligent act, you left a mop inside. It's a negligent act. You performed a surgery on a patient which resulted in the death of the patient. You were proven to be drunk during surgery. Then it is a negligent act. So all that. While performing the medical procedure, is there any
rash and negligent action of yours and death has occurred, then this section 106 of BNS applies. And the offence is punishable with imprisonment up to 2 years along with fine. But this offence should be read with the judgment of Supreme Court in Jacob Matthew case. All of us should learn what is the judgment of Jacob Matthew. I will show you what is that in the next slides. So let's see, is law in favor of doctors? These are the important sections. Section 88 of IPC or 26 of BNS. It is an act. An act is not an offence if it is done by consent. You should perform the procedure with the consent in good faith and for the benefit of another person, that is the patient. It is for the benefit of the patient, you have done in good faith, and it is done by the consent of that patient, and the act is not intended to cause death. Then this section applies. Then even if the person dies, patient dies also, it is not considered an offence. Then section 174 of CRPC, suspicious death. When a person dies not due to natural circumstances, that is accidental death, murders, animal attack, complications of surgery. See, complications of surgery they have put under suspicious death. Then this section lays down the procedure. The police officer and the executive magistrate must follow in case of untimely deaths. So if a person dies of surgical complications, a police officer can investigate what was the reason for the death, whether we have knowingly, wantedly caused death of that patient. Then this is section 304A or 106 of BNS. This we already talked about. This is causing death by negligence or rash act. Okay. So let's see what is Jacob Matthew. Dr. Jacob Matthew, this case is a landmark case in medical law actually. Jacob Matthew versus State of Punjab. In this case, an aged patient with advanced cancer. She was experiencing breathlessness and she was brought to the hospital. Dr. Jacob Matthew was there. He connected the patient to oxygen cylinder. Unfortunately, there was no oxygen. It was an empty cylinder. Then, by the time replacement could be made, patient died. See, patient is a terminally ill patient, came with breathlessness. They connected oxygen cylinder. Oxygen cylinder was empty. By the time another oxygen cylinder was connected, patient died. So the patient's son, he filed a case against Dr. Jacob Matthew that there was negligence and it led to the death of his mother. So the Supreme Court set aside the judgment. The High Court and lower courts, they held Dr. Jacob Matthew as negligent. But the Supreme Court set aside the judgment of the High Court and held that the doctors could not be criminally prosecuted. And it also defined what a professional should be. A professional is one who professes to have some special skill. A professional impliedly assures, when someone comes to us, we impliedly assure them that he has the skill which he professes to possess. If you come to an anesthesiologist for surgery, or if we will tell them or we will assure them that I am an anesthesiologist, I will handle you properly. That is what. So we
it is implied assurance, and that he has the skill which he professes to possess, and that skill should be executed with reasonable care and caution. This is important. Reasonable care and caution. So next, the second one which is important is Bolam test. This Bolam test is an age-old test. This exists from Britishers' time itself. The Bolam test states that the doctor is not negligent if they have followed a practice that is supported by a responsible body of professional opinion. Suppose a pediatrician, for pediatricians there is IPA, Indian Pediatric Association. They lay down some guidelines, protocols. If a pediatrician does a treatment according to the IAP guidelines, then he is not supposed to be negligent. Or a gynecologist does a treatment according to Foxy guidelines, then he is not negligent. Like that. If they have followed a practice that is supported by a responsible body of professional opinion. Okay. So to satisfy this Bolam criteria, doctor must use the standard of care that is expected of the average doctor. Average doctor. They are not telling high expertise doctor. Average doctor in that relevant branch of medicine. And this test also requires that the doctor's actions must be acceptable to the responsible body at that time. And this is another landmark case where the Supreme Court has given a landmark judgment in favor of doctors. This is Martin F. D'Souza versus Muhammad Ishfaq. In 2009, Supreme Court has delivered this judgment. I will read out as it is because it is Supreme Court judgment. We therefore direct that whenever a complaint is received against a doctor or hospital by a consumer forum, whether district, state or national, or by criminal court, then before issuing the notice to the doctor or the hospital against whom the complaint was made, these consumer fora or criminal courts should first refer the matter to a competent doctor or committee of doctors who are specialized in the field relating to which medical negligence is attributed. Not any doctor. To that specialist doctor against in the field of medical negligence, against which department, okay, which specialty. And only after that doctor or committee reports that there is a prima facie case of medical negligence, then a notice should be issued to the concerned doctor or hospital. See, it clearly stated that committee should be appointed, and according to the committee's report only you have to issue a notice. This is not at all followed. We have to have this knowledge. When a police personnel comes to you and tells you that an FIR has been filed against you in the station by somebody, you should tell them, please read this judgment of Supreme Court. First you refer this complaint to the health authorities. They will put a committee, appoint a committee. After that committee's report only, you can take any action or file a complaint. Then, this is necessary to avoid harassment to doctors who may not be ultimately found to be negligent. Okay. We further warn the police officials not to arrest or harass the doctors unless the facts clearly come within the parameters laid down in Jacob Matthews' case. Otherwise, the policemen will themselves have to face legal action. So, all of you please keep this judgment in mind. Okay? Don't panic whenever someone files a case against you. So, that is all the criminal liability. Now coming to the
civil liability, it is monetary compensation by pursuing a remedy before appropriate. It can be a civil court or consumer for or lok adalats. Okay. So how they calculate the compensation? Like this: actual or expected loss, physical or mental agony, damage, emotional suffering, insult, injury, pecuniary damages, and then non-pecuniary damages. And then the third one is professional, disciplinary actions that are being taken by our medical councils. We have our AB State Medical Council. If a complaint is lodged against us with the medical council, they will call us and a committee will sit and they will interview like that. They will investigate what happened. They will take a report and they will give a final decision. Sometimes it may lead to suspension of our license for a few months also. Then, what is the road for a safer practice? So, before we do a case, before we treat a patient, we have to do some pre-incident work. Usually what we do, after something goes wrong, we sit down and we will do all the consents, we will fill up all the consents, we will some documentations, all those we will be doing. Not that. We have to do pre-incident work for every case. Every case we should treat as legal. Okay. So, consent, documentation, renewal of the licenses. Our licenses should be renewed as long as we practice. And if we have a hospital, the licenses of the hospital should be in force. And we all should have professional indemnity insurance. And the most important, we should have professional unity that will help us in time of need. And when a case is filed against you, ultimately the lawyer has to go and represent us in the court. So we should provide the medical literature supporting our case to the lawyer. Otherwise, he doesn't know. He will simply keep on, he will say, this is not true to say, all these are allegations, this is not true, we have not done that. He will be saying like that. But we should provide medical literature supporting our case, our actions. Then only he can work on part of us. Okay? So what are all the various licenses? Professional license, clinical establishment license, fire license, PCPNDT license if you have an ultrasound, and biomedical waste license, pharmacy license, and narcotic drugs license. All these are various licenses we have to have, and they should be in force. And now coming to the consent. This is very important. There is nothing like an implied consent. Previously we used to think if a patient comes to us, it is implied consent. No. Now we have to take consent. So, informed written consent is the dictum. So what are the components? Disclosure, transmission of proper information that is relevant and material in decision making. The patient must be informed about the nature of the disease, what are the various options available, what are the alternate options, and he should be given choice to choose. And also success and failure rate we should explain to them, and the prognosis of the disease and the cost of treatment. This is also important. See, we will see an example. In 2009, a minor patient was operated for modified radical mastoidectomy, and the consent was taken from his father. So they did not mention any surgery. Usually we also will be doing no. They will sign. Above everything will be empty. We will tell the sister or somebody else, duty doctor, to fill it, but they won't do it.
So they did not mention the name of surgery. The risk of facial palsy was not explained to patient and relatives. After the surgery, the patient suffered facial paralysis and it cannot be corrected by any means. So the court found the doctor negligent for not informing, for not taking proper informed consent, and awarded a compensation of 1.5 lakhs. And the next one is comprehension. We should explain to them in their own language. If we don't know his language, we can take the help of an interpreter. And there should be no outside control. Some patients, if we explain to them these are the complications, they will say, no, I don't want this surgery. But that patient's son or daughter will come to us and they will say, my father says like that only, doctor, you please carry on. But we cannot do that surgery because that patient is a major, he should sign consent. Okay? The relatives can sign only the witness consent. Witness. They cannot sign the first consent on behalf of the patient when he is a major one. And the patient should be competent enough to sign the consent. Then only you take his consent. Suppose the patient is in the ICU, irritable, not able to comprehend, then you cannot take his thumb impression. Okay? Then you have to take the consent from the relatives. Okay? So these days, thanks to technology, video recording of counseling, video recording is available, so it is better we do the video recording of counseling and consent and preserve it. Usually we delete it because we don't have space for the data. And this is very important. Consent should be taken by the doctor, should be specific for the procedure and for the patient. No blanket consents. Whatever happens, doctor is not responsible, hospital is not responsible, not like that. No blanket consents. Entire thing, whatever happens during surgery, this includes surgery, anesthesia, everything, post-op care. No. Consent should be taken from the patient himself and it should be free and voluntary and it should be informed. So what are the common pitfalls while we take the consent? We think the procedure is very trivial, so no consent is essential. We think most of the time this happens during DNC procedures. Okay. So the gynecologist brings the patient to OT. She says it's a trivial procedure. Small procedure only, doctor garu. They themselves will give some pre-medication and they will try to do the DNC. Sometimes vagal shock will come, patient will land in cardiac arrest. Then the entire drama comes. So even if the procedure is considered trivial, please take the consent. Consent of the usually what we do is consent of the relatives is taken instead of the patient, even when the patient is a competent adult. This is the pitfall. And if the consenting person is minor, intoxicated or unsound mind, then don't take their consent. Please take the consent of their relative. Blanket consent is taken, not procedure specific. And most of the times, we don't take consent for blood transfusion. We do it as implied thing. So please take a consent for blood transfusion separately. And please mention all the complications. Major complications, minor complications, everything. So if you are doing a repeat procedure, please take a fresh consent. And procedure related necessary information is not given most of the time. Even if information is given, it is not documented. We tell them orally, but we don't document them. I think most of us, we don't take it seriously. Like even while taking anesthesia for anesthesia consent also, we don't write the complications of anesthesia like hypotension, bradycardia, cardiac arrest. We feel something like sentimental to write cardiac arrest in the complications box. but we have to write that. Consent lacks the signature of the treating doctor. This most of us do. The consent will be taken by the nurse. We don't sign it. Then it implies that we haven't explained. And consent is not witnessed. So once the patient signs, the doctor signs, then the relative should sign as witness and one of our staff should sign as witness. So 4 signatures should be there. One of the patient, one of the doctor, one of the patient's relative as witness, one of the hospital staff as witness. 2 witness, 1 patient, 1 doctor. 4 should be there. And once we take the consent, we will write something in between the lines. Alterations or additions are made in the consent form without patient's signed authorization. We will take consent for cesarean section. Later we will write in between the lines. For tubectomy also we will be writing. But we have to take separate consent. So, no for blanket consent. See, this is a case. Patient was admitted with throat infection diagnosed as Ludwig's angina by another doctor, advised MRI neck, but as saturations were dipping, emergency tracheostomy was done after explaining to the attendants present there. The husband was not there. Patient died during the procedure. Later, the patient's husband sued the doctor and hospital for not taking consent and negligence during surgery. But see, this plea was denied by the Karnataka State Commission as the procedure was life-saving and consent from the patient's attendants who were present there was taken and it was enough. As the husband was not there, those relatives that were present there, their consent was taken and that it was enough. And the commission noted that we have carefully pursued the complications, expected treatment that a prudent ENT surgeon has to provide. As discussed in the literature, we don't find any material on record to show that the surgeon has deviated from the standard procedure. See, the surgeon has done everything according to the standard literature and it is prescribed in the medical text. Mere operating to make the air vent by conducting tracheostomy will not come under the purview of negligence as pleaded by the complainant. This is another case. This patient was operated for appendicectomy. They took the consent from the patient and relatives. Later, re-exploration was required because the patient developed intra-abdominal sepsis and perforation. So, they took the case again for OT, but no separate consent was taken. For this, the court found negligence on part of the doctor for not taking another consent and a compensation of 1 lakh was awarded. So, this is all about consent. So, our work starts from the consent. Without consent, no patient should enter into the OT, no surgeon should operate on the patient. No anesthetist should anesthetize the patient without a proper consent. No procedure should be done. Not only surgeries, no procedure should be done. Ventilations, the ICD tubes, central lines placement, all these consent should be taken. Then let's go to documentation. What is the importance of documentation? In 80 AD itself, Roman Emperor Titus, he told, verba volant, scripta manent. That is, whatever we utter is volatile. Whatever is written lies as a mandate. So, don't just tell them, document them. It lies there forever, it saves you. So, what is the need for document? Treatment planning, recording of events, recording of complications, as a guide for future course of action and importantly as an evidence in medical legal issues. If you write it, it implies that you have written it, you have done it. So, what is the need asking for records during in medical legal things, this judge, he cannot give exactly the decision because he is faced with two parties to a dispute. Each party will give the exactly opposite version. So he cannot decide who is telling the truth. So you need records. If you have the record, if you produce that as evidence, then once written, it is just done. Okay. So you have to preserve those records. Cases can be filed in the courts up to 3 years after the incident happens. So the court cannot rely on the memory of the parties after the lapse of such a long time. And to be of help during litigation, the records must be legible. Please write neatly and accurately and in real time. Okay. So one doctor puts the time as 10:40 a.m. and writes notes. Under that notes, another doctor puts as 8:30 a.m. and writes notes. Those are the problems we face when case goes to the court. So see this one, no records. Dr. M.K. Gaurikutti versus M.K. Madhavan. Srimati Rohini had a cardiac arrest following a family planning operation, but revived with higher function deficits. Defendants, so they issued them doctors in the court. The defendants, that is the doctor or the hospital, they have not cared to produce any medical records. So they are giving oral evidence only. That oral evidence, it doesn't help the situation. So the patient attendants, they claimed 10 lakhs and he was awarded, the court awarded 3,80,000. This was way back in 1971 it happened, and this case came for judgment in 2001. So all this time doctors are harassed with agony. Then negligence in not properly preparing for anesthesia. See this. Patient died due to aspiration after administering the general anesthesia. So when it went, they showed it. So when they saw the notes, no pre-op tests were found, no PAC was done, assessment for fitness for surgery conducted. Nothing was written there. So no pre-op check done by anesthetist. So the court said there is clear dereliction of duty by both surgeon and the anesthesiologist. So surgeon and the anesthetist held jointly and severally liable to pay compensation of 10 lakhs. What is this jointly and severally? So both of you should combinedly pay 10 lakhs, or any of you can pay 10 lakhs. Okay, jointly and severally. Because both surgeon and anesthetist, they are partners, no? Sometimes they involve the hospital also. Surgeon, anesthetist and the hospital jointly should pay 10 lakhs, or severally they can pay 10 lakhs. It will be like it. Then, most of the times, many doctors will be asking me, can a government doctor be sued? We did not charge them. They will. But government doctor is taking salary. So, he is responsible. He is liable. Unless you are a trust and doctor is working in the hospital, trust hospital, by not taking a single rupee, not even a single 5 rupees investigation also should not be charged there. Everything should be done free. Then might be. But Supreme Court gave judgment that though you do the service free of cost, medical service, you cannot do negligent service. You need not pay back the compensation, like there will be no bills, no? But you are criminally liable. So what are the risk reduction strategies? Yes, one is obtain valid informed consent personally.
Then conduct a thorough pre-anesthetic assessment if you are an anesthesiologist, surgeon. Follow standard protocols and guidelines according to your associations. We have Indian Society of Anesthesiologists guidelines. Pediatricians have IAB guidelines. Gynecologists have WOGSI guidelines. ENT people, they have their own guidelines. Like that, every specialty now has an association and they have some standard guidelines. If we follow according to those guidelines and treatment done according to those guidelines, we are safe. And maintain adequate monitoring throughout the procedures. Keep comprehensive records. Update the knowledge and participate in CME programs. Maintain professional indemnity insurance. So what is this professional indemnity insurance? What is indemnity insurance? It is an agreement where one party guarantees the compensation for losses or damage incurred by another. So if we do a insurance, if we get a professional indemnity insurance, suppose a medical negligence case is registered against us and the court gave judgment of around, suppose 10 lakhs or something, 20 lakhs, that insurance company will pay on behalf of us to the patient. Okay? So, then how much insurance is enough? It depends on which specialty. Some specialties are high risk specialties. Anesthesia, super specialties, neurosurgery, plastic surgery, cosmetics, okay, cosmetology, and all those people dealing with airways, they are critical care, they are all high risk. So your premium will be high. And area of practice, rural, semi-urban, urban metro cities, like that, area of practice. How much you charge for that patient, it depends on that. And type of patients, below poverty line patient or middle income group, high income group. So if we are want to treat Ambani, then we might have to take insurance for what? How much? And number of patients you handle per year also. That is also a determinant for the selection. How much? So why we should take higher insurance premiums? Because of higher pecuniary limits in the consumer forums. So in district hospital itself, they can claim up to 1 crore. So see this, district consumer forum, Kanchipuram district at Chengalpattu, Ram Kumar versus Tagore Medical College and Hospital. This patient came to the hospital with urinary tract infection, giddiness, burning sensation in foot. So he admitted, sugars were high, they gave antibiotic. So without test dose, they gave the antibiotic. The patient had anaphylactic reaction, landed up in shock and lost consciousness, shifted to ICU. They did CPR, intubated, everything, ventilated for 3 days, discharged or shifted in an unconscious state to another hospital. So there they did an MRI scan which showed, obviously it will show hypoxic ischemic encephalopathy. Then the patient attendants, they issued the doctors in the hospital. So what are the observations of the commission? See, informed consent was not taken on admission. First, manipulation of records was done. Antibiotic treated without test dose. So they did not follow the standard protocol of giving a test dose before giving a antibiotic. First dose of antibiotic, we should give a test dose. They did not follow the standard protocol. If they have followed the standard protocol, they could have been saved. Patient also could have been saved. Then, medical record copies not provided to attendants for second opinion. This usually happens. Patient attendants will come to us, we want our records, all those reports, we will go and have a second opinion. But we will be hesitant to give them, because if we give those records and all those reports, they will go and our colleagues,
they will tell something against us. This is the most common thing that happens. And they will say, if I am the doctor, I would have saved this patient and he would have walked home in 2 days. Then they will come and they will take the patient. So we will be afraid. Already we are having only 3 patients in our hospital, and one patient goes off like this and only 2 patients will be left. So we are hesitant to give the records for second opinion. And this became an observation by the commission. And contradictory documentation in nurses' notes and doctors' notes. This happens frequently. We will write something, they will write something. We will write urine output 100 ml per hour, they will write urine output 15 ml per hour. Or we will write temperature is there 104, they will write temperature normal. So, contradictory statements in the nurses' records and the doctors. So, they directed to pay sum of 89,000 towards the medical bill, 50 lakhs as damages towards monetary loss and mental agony suffered by the complainant. And here comes the big twist. 75,000 per month from 1/5/2024 to her lifetime towards her recurring medical and maintenance charges. As long as the patient lives in that vegetative state, this doctor and hospital, they have to pay 75,000 rupees towards her monthly expenses. And further to pay a sum of 25,000 towards procedures. So total of 51 lakhs 14,431 as lump sum and 75,000 monthly installment. So which insurance company will oblige for such setup? And see, this is one landmark case. They gave 1 crore compensation for the first time. See, NIMS versus Prashant S. Dhanaka. Patient was bedridden after surgery. Actually, the patient has a neurofibroma in the ribs, under the rib region, thorax. So, a cardiothoracic surgeon operated that, usually. But the patient attendants later found that a neurosurgeon has to operate that. And they filed a case of negligence in the court. Then the judge also thought, yes, because neurofibroma means nerves only, a neurosurgeon should have operated that, unnecessarily a cardiothoracic surgeon has operated. But that lied in the thorax. So they gave this. How they calculated, see, loss of future earnings, income per annum, they will calculate like this. Age is suppose 35, probable working years till 65 as of now. So 30 years is the working thing. So 30 into R is the annual thing. Present burden of expenses, how much they are spending. Prospective burden of expenses. Attendant charges, physiotherapy care, extra pain and suffering. So totally they claimed for 7.5 crore and court awarded 1 crore. So now, is 1 crore insurance a minimum requirement? So now we have made up our mind to make 1 crore. See this one. Udayan and others versus Imaging Point and others. This was in 25th May 2022, National Consumer Dispute Redressal. This is a case of 2007. A newborn had agencies of fingers, right leg below knee and left foot below ankle joint. So it was born like that. So failure to detect, though they did the ultrasound during the 2nd, 3rd and 4th visits, they failed to detect these anomalies. So the family, they paid for a total compensation of 10 crore, 8,80,637 under different heads. So medical negligence was attributed to the doctor and his imaging center, and they were directed to pay jointly and severally 1.25 crore to the complainants. Unfortunately, the doctor's own imaging center. So If the doctor was working in that imaging center owner and the doctor, they might have shared it. Now doctor's own imaging center. So he only has to pay 1.25. So now 1.1 crore also not enough. So how we have to determine how much insurance we have to take. So this all depends on our patients, the specialty, number of patients we take, what type of patients, whether we treat sick patients or we do OP care, which area we are treating, and what purse they carry. Okay? So we have to, before seeing the pulse of the patient, we have to see the purse of the patient. So this is the concept of AOA and AOY. What is this? Any one accident, any 1 year. This is the coverage amount provided by indemnity insurance. It is referred to as the limit of indemnity. So we take, suppose we want to take for 1 crore. So that is your limit, 1 crore limit. Then they will ask, what is the AOA is to AOY ratio? How much we should set? The limit is defined for each accident within each policy period. So it is customizable. It indicates the maximum payout for a single accident. So any expenses beyond that limit is the responsibility of the medical practitioner. Let's see this. Suppose AOA is to AOY. We keep it as 1:1. That is 1 crore per accident in 1 year. So any accident any case is filed, that insurance company will pay you your 1 crore, maximum of 1 crore for one case. Suppose the second case is filed, they won't pay for the second case. Though for one case they paid only 30 lakhs, for the rest of the 70 lakhs won't apply to the second case because you chose 1:1. Only for one case you chose maximum of 1 crore for 1 year. Suppose if you choose like 1:2, so 50 lakhs will be distributed like 50 lakhs per case. You have 2 cases, 50 lakhs for one case, 50 lakhs for another case. Okay, but in one case, if the court gives judgment of 70 lakhs, then they will pay only 50 lakhs. Got it? So 1:1, 1:2 is only 50% for one case. 1:3, 1/3 of the sum insured for any one claim. 1:4, 25% of the sum insured for any one claim. So now what do you want to take? AOA is to AOY. What is the ratio you want to take? Please don't take 1:4. Because if 4 medical negligence cases are being filed against us in every year, it is better we close our shop. Okay. So the maximum, usually 1:1 is recommended, 1:2 is also advisable. And this also matters. Are you a freelancer or are you a hospital owner? If you are a freelancer, you have to take for yourselves. And it applies to wherever you go and do the case or wherever you go and treat the patient. If you are a hospital owner, you are liable for all the activities done by the other consultants, other doctors, staff, for yourselves, everything. So you have to take separately for yourself and your hospital. Okay? And if you are a hospital owner, please ensure that all the other doctors practicing in your hospital have medical indemnity insurance, professional indemnity insurance. You appoint them only if they show the insurance. Okay? You need not see their APMs also. You have to see their insurance letter first. So some people keep on asking whether we have to take
take one insurance or two insurances, two companies insurances, like that. Let us see single comprehensive insurance, simpler claim process. But what is the disadvantage? Consumer coverage limit will be there. If that is exhausted, there may not be additional coverage. Okay. If you take two separate insurance policies, as an aggregate there can be higher coverage and diverse risk management can be there, and it can cover specific coverage needs. One company, you could suppose, because I am an anesthesiologist, I will quote anesthesia examples. Suppose I am an anesthesiologist, I can take coverage from one insurance company for anesthesia and another insurance company for pain management, for my pain practice, like that. Specific coverage needs, or ICU, we can take separate insurance. But what are the disadvantages? Complex claim process. This insurer will say you have insured with that one. That insurer will say you have insured with that one. So we have to inform both of them. I have this insurance already, I am taking your insurance also. We have to inform them. And there is increased cost. And the coordination issues will be there. So we have to be very. So what is the recommendation? For most of the practitioners, single comprehensive policy with sufficient coverage is usually more straightforward and cost effective. For high risk and complex practices, you require very high coverage limits, or if you have diverse practice needs, two policies might be beneficial, but you have to manage them carefully. And please read that fine print also. When you are taking a insurance policy, read all the terms and conditions. Take your own time. Take a magnifying glass and read every line, every word, and then only you sign. So while taking the insurance, you have to be sure if everything is covered. They claim many things, but we have to be sure. We have to read and make sure that everything is covered. See, pre-litigation costs, lawyer appointments, experienced medical legal panel, and whether the compensation will be paid to the beneficiary directly or not. Out of court settlements. Many insurance companies now they claim that we will pay for out of court settlements also. That's a good thing. Whether they cover loss of documents, breach of confidentiality, covers defense cost for criminal allegations. Then best AOA is to AOA ratio, 1:1. Okay? Each service has a separate fees. So if you take 1 crore, all these services will be included. Lawyer fees also included in this only. So if the court says you have to pay 1 crore, then we will be happy. Oh, 1 crore I have got. They will pay to the patient attendants. But this lawyer will ask you 5 lakhs fees. No, 10%. 10% of the claim done. So what is it? 10 lakhs. So 10 lakhs you have to give from your pocket. So if you want 1 crore indemnity, we should plan for 1.5 crore to cover all the costs. And we have to see whether we can pay to the lawyer also from that amount. We should ask them. So how we feel is like we are saviors. But what is the reality is this one. Then, so if we see here, Captain America, he has a shield, and all this one, Iron Man, he has some shields. Superman, he has some veil or something else, some extra to save. Now we should have professional indemnity as a shield to feel like at least, okay? So, and professional unity, this is most important. Then, what is the need of the hour? We must protect patient, but we must also find better ways to protect professionals. If we do not, medical progress will cease, will stop, particularly in the controversial and distressing areas. Now I will tell you one interesting case. With that I will close. So this is a case of missing kidney, medical negligence, Telangana State Commission. See, this case I closely followed this case. It came in media. The patient went for hernia surgery. The doctors took away his kidney. That was the news in the media. And the doctor was slapped with 30 lakhs compensation. Then I called up the doctor. Somehow I called up the doctor. There will be an anesthetist for every surgeon. So I called up the anesthesiologist and then I called up the doctor. Then he told me the entire story. Let's see what is. Patient admitted for hernia surgery in Hyderabad. Preoperative investigations reportedly showed both kidneys normal. Both kidneys normal. That was the report given by the radiologist. Preoperative. After surgery, hernia surgery was done. He went home. 4 years later, he had some pain abdomen. So imaging done at some other place, some other state. They reported, imaging report, left kidney not visualized. Patient, so he alleged unauthorized removal of the kidney. So kidney racket, everyone was telling, media also very interested. And then one person who gives spiritual speeches in media, he also was telling, don't go to hospitals. Recently one patient went to a hospital for hernia surgery. His kidney was taken away. He was telling like that. So I got very offended. I couldn't stop myself. Then somehow traced this surgeon and then talked to him. What are the allegations against the hospital? Failure to explain the disappearance or non-visualization of kidney, inadequate documentation and missing records, lack of informed consent for any renal procedure. They are thinking that renal procedure was done and kidney was taken away. So they are thinking you have not taken informed consent. But no surgery was done for that kidney. Deficiency in medical record maintenance, alleged medical negligence and breach of duty care. All these were allegations. And the commission key observations were, earlier reports suggested both kidneys were present. Hospital could not produce crucial investigation records. So the burden is shifted to hospital to explain the discrepancy. Where has the kidney gone? Now, this res is Paul architect. That means the thing speaks of itself. See, it is not visible. That means the kidney is not there. That means you have taken out. Poor documentation weakened defense significantly. So judgment, Telangana State Consumer Commission held hospital and doctors liable for negligence. 30 lakh compensation awarded. Liability fixed jointly and severally. Hospital and doctor. So what are the reasonable truths? Actually, the Telangana State Commission, they appointed a committee of Gandhi Hospital doctors constituting, and they referred this case, this patient, to Gandhi Hospital to do the tests and report whether there is a kidney or there, what happened to that non-visualized kidney. So they did an ultrasound scan, left kidney not visualized, reported. This was in Gandhi Hospital. And in Gandhi Hospital itself, they did a radionuclide scan. It showed left kidney visualized, but it is a horseshoe kidney. They put some dye and something else, they do that scan, no? But not functioning. So a conclusive report was not given by the radiologist or urologist at the Gandhi Hospital. They gave these reports. Ultrasound kidney, left kidney not visualized, ultrasound scan. Radionuclide scan, horseshoe kidney, but not working. They gave these two reports and they sent off. So how can the judge know? Does the judge have knowledge about that? What is this? So threw these reports in the dustbin. They didn't consider those reports at all. That is what they told. See, hospital could not produce crucial investigation records. That they told. Okay. And there is another bit of truth behind this. The legal counsel for the doctor, he did not attend the court properly during the proceedings. He did not try to explain what has happened. So this poor doctor, not poor, he is rich, but legally he is knowledge poor. This doctor was ignorant of what was happening till the final judgment was done. So once the judgment came, so the court stamped as, you have taken away the kidney, so you pay the compensation of 30 lakhs. So we should be vigilant. We should have. So what is the lesson? Good clinical care alone is not enough. Good documentation is equally essential. Medico-legal awareness is also essential. So please monitor the medical case while it is in the hospital and monitor the medico-legal case if it is in the court. Please monitor your cases. Don't rely completely, blindly on the lawyer. Okay? Thank you. Thank you for giving me this opportunity.
Wonderful day. Not to becoming the heroes of the American Hollywood, but to stay as human beings with life and family and love and affection and to care to live for 50 at least or 20 years after our degrees to participate in lively and lively way, but not in a torrential, tormented, tortured way. And you are enlivened to the spectrum of legality. I appreciate particularly a medical doctor taking you to the legality is very important. That is a crucial component. Therefore, my dear young friends, on the sea of three benches ladder, we have to safeguard the first three benches as well as yourselves and your sisters and brothers. Therefore, at least 1% of our doctors should become legal doctors to safeguard the other things.
Yes.
Why? The last slide, if you go back, but with your permission. Monitor the medico-legal case. Madam, you are a doctor now. Therefore, I criticize the lawyers. You don't get offended.
No problem, sir.
A non-doctor lawyer never knows anything, number one. Two, if you tutor him 10 times, 5 points, he knows only 1 point. He wants to tell it in the court, he forgets 50% of that point and tells the opposite 50%. Therefore, never a case ever comes to your rescue by any lawyer across the length and breadth of India, except when that lawyer is primarily a doctor. Because your Supreme Court lawyers will not come to this case because it is bitters, even though they have little brain. Don't expect a lawyer to have a full brain. She had a full brain because she is a medical doctor first. And ఎందుకంటే మీరు 10 పాయింట్లు చెప్తే ఆయన హరీలో 9 పాయింట్స్ మర్చిపోయి 1 పాయింట్ అక్కడ చెప్పబోయి అటువంటి చెప్పి he favors the other counsel rather than your counsel. Because in my personal experience for the last 40 years in which I have filed cases, filed repeatedly, fought repeatedly over 1.5 to 2 decades across district, state and national forums for a brilliant doctors of highest amount of academic expertise and surgical skills par excellence of international level. But they won't come to your rescue when you are standing in the court. They will ask you a question, you have to tell yes or no, but not my experience and this and that. They don't listen. They only listen to your lawyer, but lawyers rarely have the brain in the calvaria. They have brains more towards the knee. That's why we need doctors becoming lawyers because they preserve their brain in the calvaria. Therefore, never ever take cognizance and take confidential and confident support from any lawyer, including your own brother who fights the case. Because I have seen that also. That's why you are responsible for your argumentation, your documentation. Arguments depend on documentation. Another important point ఏంటంటే ఆవిడ చెప్పడం కొంచెం ఎందుకు తిట్టాలని కానీ చెప్పలేదు డాక్టర్. ఆవిడ సాఫ్ట్గా రైటింగ్ అన్నారు. ఒక్కసారి కేసు ఫైల్ చేశాడంటే మీకు తెలియకుండానే మీ కేస్ షీట్ అంతా వాడు ఫోటో కాపీ తీసి అక్కడ ఫైల్ చేస్తాడు. ఆవిడ సబ్మిట్ చేసిన తర్వాత మీరు రాసినవన్నీ వచ్చేసరికి ఇట్ బికమ్స్ మాల్ ప్రాక్టీస్ అండ్ tampering the case sheets. Tampering makes the violent amount of reaction by the judiciary. Instead of giving you 10,000 compensation, it just adds 2 or 1, 3 hollows, zeros to you. Because that's one of the cases which happened. Calcutta Commission from against the President of the All India Associate PhDs of India, President, who is the doctor to the Prime Minister at that time. And he is a rheumatologist of international expertise, written monograms of chapters beyond of par excellence. But he was sued in 1998 itself for a long period, but not recording that examination should be given after 4 weeks or 6 weeks or 9 weeks. That lady took it for 1 year, and all complications occurred. Who is from Dubai to here, Kada. They just sued him about 20 crores, and the commission allotted him about 1.5 crores at that time, in the last century highest amount. Now, crore is nothing like a blanket torn out coat. ఇప్పుడు మనం పెళ్ళిళ్ళప్పుడు కోట్లు కొట్టుకుంటాం కదా, బ్రైడ్ గ్రూమ్. ఆ కోట్లు ఇంకా ఇక్కడ బియ్యం కానీ ఈ కోర్టులో కేసుల్లో కోట్లు వేస్తారు. అంచేత మై డియర్ అండ్ ఫ్రెండ్స్, యువర్ ఫ్యూచర్ ఈజ్ నాట్ గ్లూమీ నాట్ బ్రిలియంట్ నాట్ షైనీ అన్లెస్ యు ఆర్ వెరీ expert in documentation. One case is sufficient to make you out of the ring. Thank you, madam, for alleviating what is called energizing and at least making them to alert, making them to know what is in store for their future practice. Because we are off the ring. Because we are so many huge number of sheep and goat, where which the shepherd should be very active. The shepherd, if he comes from the sheep rearing community but not the sheep eating community, that is why we will better cover.
Many people will be asking me why I chose to become a medical legal consultant. Why I studied law after I did medicine. Because in 2019, my daughter wrote NEET undergraduate exam. When she was preparing for her NEET, I used to sit beside her. Then I thought, this girl is going to become a doctor. Till now, I have somehow managed to practice without any litigations. But what about the future generation? Then my son, he came behind me and he was also telling, I also will take byDr. Then I thought, how many doctors are going to be there in my family? Then I counted 11. 11. Every year for one person, go over. Then I thought, okay, I will do law. Then I can protect, at least guide my family. Then my fraternity. My specialty, then my medical fraternity also. So that year itself I wrote law set exam and I got into government law college, AC college, and to my luck then COVID came. So I did not go to college. Then in the last year I went to college, so I finished it in time and then I became a medical legal consultant. Now I have 5 lawyers on board in my firm. We take cases but I don't allow the doctors to directly go to the lawyer. They should first meet me, then we will write the versions. First initial case report, everything, but that has to be filed. We will make lot of long discussions. All the lawyers, the doctors and myself will sit together and we make long discussions for 5 to 6 hours. And then we will write the versions. I will finalize the versions and give it to the lawyer. Then I will keep on tracking them. So this is what is being happened. And anyone who has any problem, or if you have a question also, or any even doubt, any doubt, you are free to call me, wake me up at any time. I will give advice as per my knowledge. I will not charge. Thank you.
You in consumer forum, until it is settled, the medical council cannot take action against you. If it takes, it is a prima facie offense, because I can't relate very well to a good number of cases in which we cannot have two punishments simultaneously. That you should know it. Either from police, or from the judiciary, or from your fraternity of counsel which should protect. That's important. And lastly, if you become a doctor lawyer, you will have enormous practice from length and breadth of you. Because one of the greatest lawyer, a doctor turned lawyer, is from Bombay, who is a roaring practitioner of other things. No, I'm talking about this is last century. This is nowadays. And when some case come, he was given a punishment of little tender. I paid 10 lakhs and 5 lakhs for this lawyer. And I got charged about 10,000 rupees for the bloody thing sweating there now. Why can't he become a lawyer? He became. Then he started charging doctors very little, but other. And very little charge of 10,000, 15,000 doctors feel very happy because they are not allowed to pay another sunnah. 10,000 sunnah, 1 no, 2 sunnahs, 10 lakhs. Therefore, they don't mind paying 1 lakh for him. There is no 50,000, not 700. You will pay you 1,000, 1 lakh after that. In that format. Now he became so big a man for you to talk like your Supreme Court lawyer who will put the button. Supreme Court lawyer దగ్గరికి మీరు వెళ్ళాలంటే వెళ్ళిన తర్వాత ఇంటర్వ్యూ ఇచ్చాక టైం క్లాక్ ఆన్ చేస్తారు. You tell the problem. If you start telling the problem for hours, that itself is a fees of about 5 to 6 lakhs. He doesn't tell you file or not. ఆ 5 lakhs ముందు ఇచ్చి పైకి వెళ్ళాలి. అంటే మీరు ముందు రాసుకుని ఏం మాట్లాడాలో మాట్లాడాలి. హైకోర్టు అయినా సుప్రీం కోర్ట్. That is the quantum of them. That's why they never become doctors. They see how many doctors are there vulnerable for them. Of course, therefore, he is a sheep in a wolf's ground, but not a wolf in sheep's ground. Thank you, madam.